Welcome back. In this video, we will go over the anatomy of the hip joint. The hip joint is formed by the articulation of the hip bone and the femur, the bone in the thigh. The hip joint, structural-wise, it is a synovial, ball and socket joint. Functional-wise, it is a diarthrotic joint. Starting with the bones, this right here is the ilium. That's the iliac fossa. We can see the pubis bone. This right here is the pubis anteriorly. We can see the femur, and posteriorly on the hip bone, we can see the iliac bone right here and the ischium bone. This is the ischial spine that separates the greater sciatic notch, which belongs to the ilium, from the lesser sciatic notch, which belongs to the ischium. And this right here is the ischial tuberosity. You can also see the greater and the lesser trochanter. This right here is the obturator foramen. Starting with the first ligament, this ligament, notice how it runs between the pubis and the femur. This is the pubofemoral ligament. Moving to the next ligament, this ligament which runs between the ilium and the femur. This is the iliofemoral ligament. Moving to this ligament right here, which also run between the ilium and the femur. This is the iliofemoral ligament. Moving posteriorly, we can see the ligament that runs between the ischium and the femur. This is the ischiofemoral ligament. So let's repeat the ligaments one more time. Follow the direction of the fibers in the ligament. This runs between the pubis and the femur. This is the pubofemoral ligament. This right here, it runs between the ilium and the femur. This is the iliofemoral ligament. Moving posteriorly, this ligament that runs between the ilium to the femur, this is the iliofemoral ligament. And this ligament that runs between the ischium and the femur, this is the ischiofemoral ligament. I hope you found the video helpful. Check out my video on the anatomy of the femur and the anatomy of the pelvic bone.